GIFSHIP N, the NHIA health insurance program that gives free access to affordable and quality health care to members of the National Youth Service Corps, NYSC, has been running for 1 year now. How did it all begin? 2016, some members of NYSC lost their lives while traveling from one part of the country to another. With access to health care, these patriotic Nigerians might have been alive today. So President Muhammadu Buhari directed that corps members should be included in NHIA program. These inspired the creation of GIFSHIP N, Group, Individual and Family Social Health Insurance Program N for NYSC. But the initiative did not take off immediately until the appointment of the present Director General of NHIA, Professor Mohammed Sambo. Professor Sambo's resilience and determination, in conjunction with the then DG of NYSC, Brigadier General Shoaibu Ibrahim, culminated in signing of a memorandum of understanding between NYSC and NHIA and the flag-off on February 11th, 2022. The program essentially ensures that corps members have access to health care throughout their 11 months of service and 3 weeks after their passing out. How does this program work? I sat down with General Manager, Formal Sector Department, Dr. Jonathan Eke, whose duty is to implement GIFSHIP N. How has the program fared in the last 1 year?
The NYSC program, for me, has been a very, very good program we've been implemented. It's a program that when we started, we were, you know these corps members now, we were afraid because these guys are on social media before they will go and say this, say that. But I can tell you that in the implementation of this program, it's been a great work. And even the corps members are very happy. Those that have had contact with the health system through this program are very, very happy about that. Even the NYSC, National Health Insurance Directorate, are quite happy because they believe that it's taking off a lot of administrative load from them. We have been receiving commendations from corps members. I said that earlier. So many of them. In fact, there was a corps member that gave birth to quadruplets. I've had so many of them, even some of them been taking care of their cancer problems. And one good thing about this program is that the NYSC program, the way we design it or adapted it, is not even like the normal GIFSHIP program, because we don't really allow them to go, the corps members to go without treatment for any condition. In terms of drug, we try as much as possible to ask the HMOs to give codes for even those drugs that are not on our drug list. So, but what we have tried as much as possible to give them a very, very comprehensive package of care within the frame of the NHIS benefit package.
We spoke with the DG NHIA and Director Corps Welfare NYSC, as well as beneficiaries themselves.
So far, all the batches that have come from February are now being fully enrolled, and they benefit from the social health insurance services. The strategy we adopt is that in the camp, when they are in the camp, we go and sensitize them, and we register them and give them our NHIA number. And from the camp, NHIA will provide services for them while they are in the camp. And when they move into their places of their primary assignment, they select the hospitals that they want to be attending, and NHIA will now begin to extend the cover. We have divided the country into 6 geopolitical zones. Each zone is handed over to a particular HMO because in our operational guideline we have to use HMO for our operations. So each geopolitical zone is handed over to a particular HMO. So they are currently providing the services, and so far we have not had any issue because we have prepared very well, and we work very closely with the leadership and the staff of the NYSC to drive the program. And the corpers are happy. They are now enjoying services.
I want to believe that majority of them who have accessed care and who have found out that the initiative is real, they are our gospelers. Gospelers for NYSC, gospelers for NHIA, to go and spread the good news out there. In fact, to their family members who would ordinarily not have enlisted in under NHIS. So I believe that by and by, the core members, one, have responsibility of presenting themselves for medical care. I told you earlier on that there's a general awareness among them. And number 3 is the fact that they are the one to spread the good news that this thing is very real. You know, to an average Nigerian, when something is free or is without any exuberances, nobody wants to believe it is working. But they being the beneficiary, direct beneficiaries of NHIS and NYSC initiative, which we call GIFSHIP N. So they are the ones that will be able to tell the story that of a truth, there is something, there's a system in Nigeria that works and works perfectly for their benefit. My observation is that the response time to issues on the part of NHI is very, very excellent. Anytime we had any issues, challenges coming up from time to time, a mere phone call to Dr. A.K. Jonathan will solve the problem, almost 95% immediately. So I think it's a commendable practice, which I think organizations should also emulate so that things and our systems can work excellently well. It has been success story galore on the part of NYSC, on the part of NHI, and even the beneficiary core members. My take and my words to Nigerians out there is that health is wealth. It's only a healthy body in a spirit, soul, and body that can render service. It's only when you are healthy that you can have hope of making your own contributions. My take is that people should take the issue of their health very, very seriously. Let them also, when they are sick, attend to their health at the hospital. It's not too much to commit a part of our earnings to medical checkup in the hospital. And above all, let Nigerians know that the NHIS issue of health insurance is real in Nigeria. It's working. At least I've seen it in NYSC. Working for my core members, about 350,000 core members enlisting yearly because it's compulsory for every core member to enlist. I want to sell the idea to Nigerians out there that they should get themselves enlisted on NHIS because of the very many benefits that the scheme offers to the public.
A very big thank you to
HIA.
Okay, HIA. For the gifts and the love they showered on me and my babies today. I want to say a very big thank you to them. So many core members who are pregnant or who are having one health challenge or the other, I think has benefited from this program so much, because some of the core members don't have the financial background to support their medical fees or bills. So I think this program has helped a lot of people and still helping people. Like I here, I'm a beneficiary and I want to say thank you.
During my service here, 3 months during my service here, I fell sick. I went to the hospital and I was treated for free and given medication. I did not pay anything.
For the fact that the government deemed it fit for the platform to exist,
is a good thing. So I'd advise all incoming core members to register like every other, because you don't know when you will need this platform to either for health purpose actually.
Yeah, they actually welcomed me when I told them I was a copper. I told them I want to see a doctor. So they now open file for me and give me the card to see a doctor. And after I saw the doctor, they prescribed drugs for me. I would like all my core members to take this very opportunity, because I'm just imagining myself serving in Abuja, I don't have anybody here, and I fell ill. I will now go to another hospital to spend some money. So I want to just encourage all my core members to be part of NHIS.
It was quite an easy one because they have a unit for NHIS, so I went there, they attended to me, they sent me to the doctor. I had to join the queue because it's a general hospital and there were lots of people there to see the doctor, so I attended the doctor. They sent me for tests and I did registration. Considering the fact that we are trying to manage costs, and then since federal government has already provided the healthcare for us to access easily anytime we can, I guess it's a good idea and it's a good thing for all core members to join hands and participate in it.
During my 1 year of service, along the line I fell sick with typhoid. Then from there I have to access that of Nyanya General Hospital. But along the line I forgot about it, but when I went there, the personnel that was there, it was a medical doctor who was also serving too. Then he asked me, are you a core member? I said yes. And I said, have you heard about it? Why don't you go and visit them and register? I said okay, but I was down. He said no problem, just paid everything normal. After your sickness and everything, you can go and register, so they will refund back your money to you. So after everything, I went back.
The overriding objective of NHIA is to achieve universal health coverage by the year 2030. All Nigerians are to have access to affordable and quality health care. GIFSHIP N fits perfectly into that objective.